I'm going to introduce you to the task training room, a room that can be used to educate procedures to nurses and physicians. And the first thing we're going to look at is a laparoscopic trainer that teaches people dexterity to do laparoscopic surgery, and I'll demonstrate. So the learner picks up, drops it on the other, and then transferring from one to the other. And this was what the surgeon would do in the operating room, but instead of learning on the patient, they can learn in the simulation lab. So this would allow a surgeon who needs to learn a new technique or that has to refine his skills to do it in the simulation center and be much better prepared to go in and do it on a patient. So this is a ultrasound task trainer that allows a learner to use ultrasound on a mannequin with both anatomical renderings and then actually what the ultrasound image will reveal to the patient. So here you can actually see the heart beating on the mannequin in an anatomical, and then if we move the probe, you'll be able to see the heart beating actually as it would appear to the learner in the ultrasound. So this allows the learner to take the anatomy they learned in classroom, apply it to the mannequin with the ultrasound, increasing their skill set and then taking it to the bedside with a patient. And you look at abdominal organs, the intestines, you can look at the lung, the lining of the lung, see the heart beating there, and actually you can see a kidney here representing the kidney there. So it allows the learner through the entire body to use the ultrasound, which is a rapidly developing skill set that learners have to use, either physicians and nurses, nurse practitioners, physician assistants at the bedside. Okay. This is Harvey. He is a mannequin that allows learners to learn different heart sounds, both normal and pathologic. It's a real stethoscope that once placed on Harvey, you actually punch in the code for either normal, pathology, a significant murmur that the learner can learn on the mannequin prior to going in to see the patient to hone their skill set. So this is often used by nursing students, medical students, residents, or a nurse that needs some more refreshment on fine-tuning her skills at physical exam and heart ultrasound. So this is a task trainer, part of a mannequin that you can actually simulate or teach someone to do a spinal tap, or what we traditionally call a lumbar puncture. And this mannequin actually has a spinal cord, vertebral bodies. You can actually palpate as a physician would do, either with or without ultrasound. You can actually teach a learner with a spinal needle to feel his landmarks. We would traditionally numb up with lidocaine, but for demonstration purposes, we would literally start to pass the needle in and you can see the spinal fluid dripping out. So you would actually be able to teach a learner in a non-threatening environment and not putting the patient's safety at risk how to do a lumbar puncture spinal tap. And they could literally simulate 2, 3, 4, 5, 6, however they needed to become skilled. And then that person would be the healthcare provider would be much more adept to go do it on a patient. So what we're demonstrating now is with a true Da Vinci robot. One of the residents is actually doing a simulated surgery in a urological procedure in the sim center to hone his skills. And the residents can come up here and use this robotic surgery at any time. So the more hours they log on to this robotic, the better surgeon they'll be when they're actually in the operating room with their senior attending, or eventually when they become an accomplished surgeon.